So, NCLEX questions are not testing whether you memorize facts. Uh, they are really testing whether you can think safely like a nurse. So, let's break at this question. This is very important topic for the NCLEX. So, a client diagnosed with heart failure has an 8-hour urine output of 200 ml. So, what is the nurse first action? So I would recommend you to pause this video right now and try to answer it, yourself before we go through the options. So uh, before even looking at the choices, let's understand what the question is really telling us. So this patient only made 200 ml of urine in 8 hours, right? So let's divide 200 by 8. So it's roughly around 25 ml per hour of urine output. So as you remember, the normal urine output should be at least 30 ml per hour. So this patient have a low urine output, right? So now the next question is, why would a heart failure patient have a low urine output? Because in the heart failure, the heart cannot pump blood effectively, less blood reach to the kidneys, and when kidneys don't get enough blood flow, your urine output drops. So now we will go through each choices like a NCLEX thinking. So first, let's look at the choice 2. Encourage the client to increase fluid intake. This sounds tempting because um, you know low urine output can happen in dehydration, but this patient has a heart failure. So heart failure patients are already at risk of volume overload. So giving more fluid without assessing first could make a pulmonary edema, like a fluid in the patient's lungs, worse. So this is not the safest action. So next we will look at the choice 4. So start an IV line for diuretic administration. So this might eventually happen, but NCLEX love testing one rule, and which is assess before you intervene. So you cannot just jump straight into treatment before assessing the patient. So if we look at the choice 3, it says report the finding to the healthcare provider. So again, this may happen later, right? But before that, we have to assess the patient, right? So this is also not the right choice. So we cross 2, 3, and 4. Now the choice 1 is auscultate the client's breath sounds. So this is correct because you as a nurse have to assess the patient first. So you have to listen to the breath sounds to look for volume overload. Do you hear crackles in the patient's lungs? Remember, heart failure plus low urine output can means like patient's cardiac output is very poor, like patient heart is not pumping enough blood, and that's why the fluid is backing up into the lungs and the patient have a crackles, and the less fluid is reaching to the kidneys, and the kidneys have a low urine output, and that's why patient making a low small amount of urine. Here's the big NCLEX rule you should remember. When you see words like first action, best action, initial response, always ask yourself, do I need to assess first before intervening or reporting to the healthcare providers? Because most of the time on NCLEX, assessment comes before interventions. So I think this is a very a good example of the question, and I hope it helps. And if you will have any question, please drop it in the comment, and I would try my best to answer. Thank you.